you are a senior traveler with a knee replacement, a hip implant, a shoulder joint, or even a simple mobility aid, the airport security line can feel like the most intimidating part of your entire trip. Many older travelers say they are not afraid of the airplane, the takeoff, or even the long flight. What they worry about most is that moment at the security checkpoint. They worry about alarms going off. They worry about being pulled aside. They worry about being rushed, confused, or embarrassed in front of a line of impatient passengers. And for many seniors, the biggest fear is being directed into what they call the side lane, where extra screening takes place in recent years. Travelers and travel advisors have started using a phrase called the knee and joint rule to describe how airport screening has evolved for passengers with implants. It is not an official rule with that exact title, but it reflects an important shift in how security procedures and scanning technology now work. Modern scanners are better at identifying medical implants. Officers are more experienced in assisting older passengers, and airports have become more aware of the needs of senior travelers. The result is a process that can be smoother and less stressful, as long as you know what to expect and how to prepare. Many seniors are surprised to learn that joint replacements are extremely common at airports. Every day, thousands of travelers pass through security with artificial knees, hips, shoulders, and other orthopedic implants. Security officers see these situations constantly. You are not unusual, and you are not a problem passenger. In fact, in many airports, seniors with implants are a normal and expected part of the screening process. The reason implants matter at security is simple. Most joint replacements are made from metal alloys, and these materials can trigger alarms in traditional metal detectors. Some implants are small enough that they do not cause any reaction at all, while others are large and dense enough to set off alarms every time. This is especially true for full knee and hip replacements. That is why preparation and communication are so important. The first and most powerful security hack for seniors is also the simplest. Always inform the officer about your implant before you step into the scanner. This one small action can change your entire experience. When you approach the screening area, calmly say something like, "I have a knee replacement," or "I have a hip implant." You do not need a long explanation. A simple, polite statement is enough. When officers know about your implant ahead of time, they are prepared for what might happen. If an alarm goes off, they already understand the likely cause. If they have a choice between scanners, they may direct you to the one that works best for passengers with implants. Most importantly, the interaction becomes predictable instead of surprising. Now imagine the opposite scenario. A senior passenger says nothing, steps into the metal detector, and the alarm sounds loudly. The officer now has to stop the process, determine what caused the alarm, and possibly move the passenger aside for additional screening. The traveler feels confused. The line behind them grows impatient, and stress levels rise quickly. All of that can be avoided with a single sentence before the screening begins. Another important change in recent years is the widespread use of advanced body scanners. These scanners do not work exactly like traditional metal detectors. Instead of simply detecting metal, they use safe imaging technology to create a general outline of the body. This allows the system to detect unusual objects without relying solely on metal detection. For many seniors with implants, this technology can reduce the number of alarms and unnecessary pat-downs. If you see a choice between a simple metal detector and a full-body scanner, it is often helpful to politely ask for the body scanner. In many cases, this can lead to a smoother experience. The scanner may still notice the implant area, but the process is usually quicker and more targeted. One thing seniors should understand is that extra screening is not a punishment. It is simply part of the safety process. Even if you inform the officer about your implant, and even if you carry a medical card, you may still receive a brief additional check. This does not mean you did something wrong. It just means the officer is following standard procedures. Many seniors also carry implant identification cards provided by their surgeons. These cards describe the type of implant and the date of surgery. While these cards can be helpful for communication, they do not exempt you from screening. Officers cannot simply accept the card and wave you through. However, the card can make the conversation smoother and more comfortable. Another major concern for older travelers is the so-called side lane. This is the area where additional screening takes place. Many seniors imagine it as a stressful or embarrassing experience, but in reality, it is usually a calm and respectful process. The key is understanding why people end up there. In most cases, the side lane happens because of one of three reasons. The first is an unexpected alarm. The second is the presence of a mobility aid that requires separate screening. The third is a situation where the traveler needs extra time or assistance. Here is the important truth. In many situations, you can influence whether you end up in the side lane. Preparation makes a huge difference. When you communicate clearly, arrive early, and choose the right screening lane, the entire process becomes more predictable. One of the best strategies is to use the accessible or assistance lane whenever it is available. Many airports have special screening lanes designed for families, seniors, and travelers who need extra time. These lanes move at a slower pace and are staffed by officers who are experienced in helping passengers with special needs. Using this lane is not a sign of weakness. It is a smart travel decision. Another helpful tip is to give yourself extra time at the airport. Even though screening is often quick, there may be moments where an additional check is required. When you arrive early, these small delays do not feel stressful. Instead of worrying about missing your flight, you can stay calm and let the process unfold naturally. Now let's talk about mobility aids. Many seniors travel with canes, walkers, or wheelchairs. These devices must also be screened, just like luggage. Officers may inspect them or send them through the scanner, but that does not mean you will be left without support. If you cannot stand or walk comfortably without your aid, tell the officer immediately. They are trained to assist passengers with mobility needs. In many cases, they can screen you while you remain seated or supported. Sometimes they will even provide a temporary non-metallic cane while your own device is being inspected. Clothing also plays a big role in your security experience. Large metal belt buckles, heavy jewelry, or shoes with metal components can trigger alarms. When this happens, the officer must determine whether the alarm was caused by your clothing or your implant. This can lead to extra screening that could have been avoided. That is why it is helpful to dress with the checkpoint in mind. Wear simple, comfortable clothing without unnecessary metal. Choose shoes that are easy to remove if required. Leave bulky jewelry at home. These small decisions can make the process much smoother. Another powerful strategy is traveling light. When seniors carry multiple bags, loose items, and complicated belongings, the screening process becomes more difficult. Every item must be placed in a bin, scanned, and retrieved on the other side. This can feel overwhelming, especially when other passengers are moving quickly. By packing lightly and keeping your carry-on simple, you reduce stress and speed up the process. A single, organized bag is much easier to manage than several smaller items. Traveling with a companion can also make a big difference. A friend, spouse, or adult child can help manage bins, handle luggage, and communicate with officers while you focus on your balance and comfort. Many airports allow companions to assist seniors through the screening process. It is also important to understand your rights at the checkpoint. If a pat-down is required, you can request a private screening area. You can ask for a same-gender officer. You can also request that a companion be present during the process. These options exist to protect your comfort and dignity. Some seniors worry that scanners might harm their implants. In reality, standard airport scanners are designed to be safe for passengers with medical devices and orthopedic hardware. The technology used in these scanners does not damage implants or interfere with joint replacements, so if you have been avoiding the body scanner out of fear, you may actually be making the experience more difficult than necessary. In many cases, the body scanner is the smoother and faster option. Let's walk through what a calm, prepared security experience might look like for a senior traveler in 2026. You arrive at the airport early, with comfortable clothing and a light carry-on bag. You approach the security checkpoint and choose the accessible lane. When you reach the officer, you smile and say, "I have a knee replacement." The officer nods and directs you to the body scanner. You step in, raise your arms as instructed, and the scan completes in a few seconds. If the scanner notices the implant area, the officer performs a quick, targeted check. It takes less than a minute. There is no confusion, no embarrassment, and no stressful side lane experience. Within a few moments, you are gathering your belongings and heading toward your gate. That is the reality for many seniors traveling today. The process is not perfect, but it is more predictable and more respectful than many people expect. The most important mindset shift is this. The goal is not to avoid screening. The goal is to control the experience. When you communicate early, choose the right lane, dress appropriately, and allow extra time, security becomes just another routine step in your journey. In the past, many seniors felt singled out during screening. Today, procedures are more standardized, officers are better trained, and technology is more advanced. The experience continues to improve each year, so if you are planning a trip and you have a knee replacement, a hip implant, or a mobility aid, remember this simple checklist. Arrive early, use the accessible lane, inform the officer about your implant, choose the body scanner when available, Travel light and dress simply. Ask for help when you need it. These 6 steps can transform your security experience from stressful to smooth, because travel should be about the journey ahead, not the anxiety at the checkpoint. And with the right preparation, even airport security can become just another calm, manageable part of your trip.